I like to go over my top 3 misconceptions that I've heard over the many years I've been as a hand surgeon. And these are things that are totally wrong, but for some reason, they seem to be percolated throughout the community, and it seems to be kind of cycled over and over again. So one of the top 3 misconceptions, I'll start with number 3, would be, if you can move your fingers or your hand, it cannot be broken. That is not true. If you fall and you had any type of trauma and there's bruising and pain, and although you can still move it, it can still be broken. I have done surgeries on the scaphoid bone where it's a bad injury with very negative consequences of miss, and the patient can move their wrist after they break it, and they didn't know they broke it, and they're so shocked when I tell them, here's your x-ray, it's broken, this needs surgery. And they're like, it can't be broken because I can move it. Someone told me if you can move it, it can't be broken. That's not true. If you get hurt, come in, let us see ya, let's get a quick x-ray, and then we'll guide you through the process, and we can give you the positive reassurance that's not broken after it being verified by a quick x-ray that we can do in the office. The number 2 biggest misconception I can think of is that if my fingers go numb, that's just normal for aging, and that I should learn to live with it, and there's nothing that I can do about it. That is wrong. Aging is a natural phenomenon. You get gray hairs, you get wrinkles, that's aging, we all understand that. But numbness and tingling or pins and needles in your hands are never a normal component of the natural aging process. So that's never, never true. If your hands are going numb and tingling, and that's happening on a regular basis, you need to come in to see a hand surgeon to make sure you don't have carpal tunnel syndrome, cubital tunnel syndrome. Those are very common problems where the nerve is being pinched. And those have simple, elegant solutions that can fix it and can dramatically improve your life and prevent further future permanent damage. So that's misconception number 2, that getting numb hands is just part of aging. And then my number 1 misconception I really don't like is when people tell me, Doc, I think I broke my finger, or I have arthritis in my finger, but there's nothing you can do about it anyways. You're just gonna buddy tape it. That's not true. There are a multitude of things we do for fingers that have trauma or arthritis in the fingers. When things get really bad, there are lots of options, including knuckle replacements, knuckle fusions. And yes, when you break your fingers, we do surgery on fingers. And it's not always just buddy taping them. Buddy taping is when you tape the 2 fingers together and allow them to move. We do that when it's minor injuries that don't need surgery. But when fingers are badly damaged, they need the expertise of a hand surgeon, someone that can kind of guide you through that course, because it can be a very rough road from start to finish, so that your hand works again, you can make a tight fist and open up again. That's the ultimate, where we want to be at. And in order to get there, it can be a rough course, and you need a hand surgeon with the right therapist to kind of guide you through that course. So those are my top 3 misconceptions.